When considering second-line therapy for patients, I again take into account multiple factors: the patient's age and their functional status, their end organ function, what their goals of therapy are, and what their profile of prognostic markers look like. Again, for patients that haven't had TP53 dysfunction found in either deletion 17p or TP53 mutation, testing for this again is critically important, as that will take you down a different route of considering options. However, in general, in the second line, patients that had chemotherapy as a first treatment are likely to have a much shorter duration of response if chemotherapy is used in the second line. And this is increasingly why we're using the novel targeted agents in the second line over repeating chemotherapy, unless patients have a specific reason for the chemotherapy again, or if they had a longer duration of response to chemoimmunotherapy as a first treatment. For this patient who has a known deletion 17p, what I consider for her second treatment, because she's overall functional, wants a goal of treatment to keep her in a good quality of life for as long as possible, and she has sufficient organ function, I consider treatments that I think are going to get her the best response and the best duration of response. For her, the ibrutinib was not tolerated, and she again progressed very quickly. Because she had a high burden of disease in the bone marrow as well, I considered venetoclax, as this is approved for patients with relapse refractory CLL with the deletion of 17p in order to achieve a deep response, such as a complete response, that hopefully will last her for many years. BCL2 has long been recognized as an important anti-apoptotic protein. That is, it pushes cells away from the normal process of programmed cell death. When you target BCL2, you take away that anti-apoptosis and restore the normal process of cell death. Therefore, when venetoclax targets this protein, which is especially important in keeping the CLL cells in the anti-apoptotic side, you push them more to the state of cell death. Venetoclax has been studied in several phase 1-2 clinical trials for patients with previously treated or relapse refractory CLL. In one of those studies, venetoclax was additionally combined with rituximab, and for those 49 patients, over half of patients achieved a deep, complete response to their therapy, which was especially impressive given these patients, many of them had had several lines of prior treatment.